Today we will demonstrate the implantation procedure of the femoral reverse intramedullary nail tube. The patient is placed in a supine position. The affected limb is prepped and draped, with fluoroscopic guidance applied. The intramedullary nail is inserted through the distal femur intercondylar notch. Confirm the approximate entry point under fluoroscopy. Use the targeting guide for positioning. Insert a threaded guide pin through the guide for initial positioning. If the first pin placement is unsatisfactory, alternative holes can be used for repositioning. Use an entry reamer over the guide pin to create the entry portal. Perform distal femoral canal reaming with an entry reamer. Insert a reduction rod to achieve fracture reduction. After satisfactory reduction, insert a ball-tipped guide wire. Then remove the reduction rod while maintaining the guide wire. Perform sequential reaming of the medullary canal using flexible reamers over the guide wire. Next, we will drive in the main nail. Attach the intramedullary nail to the insertion handle and secure it with a locking bolt. Insert the nail along the ball-tipped guide wire into the medullary canal. Install the distal targeting arm. Align the targeting armholes with the handle interface. Secure the targeting device with locking screws. Proceed with distal locking hole targeting. Insert the protective sleeve and drill guide. Drill the hole under fluoroscopic guidance. Repeat the procedure for remaining holes. Measure the hole depth using a depth gauge. Select appropriate locking screws based on the measurement. Insert locking screws using a hex screwdriver with a T-handle. Install the proximal targeting device. Select the appropriate mounting hole according to nail length. Attach the lateral support bracket. Secure the bracket with locking screws. Insert the sleeve and drill guide. Drill using a 5.2 mm drill bit, followed by a flat-ended drill. Keep the sleeve in place and insert the positioning rod. Lock the positioning rod with a fixation block. Perform proximal drilling similar to distal locking. Insert the sleeve and guide, then drill the hole. Axial and lateral holes are treated in the same manner. Proceed with proximal screw insertion. Pre-tighten screws using a screw holder. Finalize tightening with a hex screwdriver. Complete proximal locking. Remove all guiding and auxiliary instruments sequentially. Remove the locking nut from the handle. Insert and tighten the end cap using a hex screwdriver. Procedure completed.